All right, I'll get us started. Isabella, can you go forward one? All right. So just a couple of things before we get started. I think it's going to be easier if you let Isabella and I go through all of the information that we need to go through, and then save your questions for the end. You certainly can put them in chat, or you can at the end, you can unmute yourself and ask a question. How this will work today is we'll go through everything that we have, get done with that, and then we'll stay as long as you want us to, within reason, and to answer any questions that you may have. So you want to hop off when we're done, that's fine. If you want to stick around and ask questions, you certainly can do that as well. So with all of that said, we'll just kind of move right into it. As United Way is moving into the grant cycle and how we got there, we just want to talk about, what are our priorities? Every grant typically does have a priority, and United Way is no different. So the first thing that we want to look at is community impact. I believe it was about 7 years ago, United Way worldwide, and specifically United Way of the Greater Chippewa Valley, moved into a community impact model. Where we shifted from funding agencies to funding programs. That hasn't changed. It's probably not going to change. That is where United Way is. That's where United Way Worldwide is, and that's where United Way of the Greater Chippewa Valley is, and that's where we are again for this grant cycle. Under that, we have 4 initiatives: health, education, financial stability, and basic needs. Under those, each initiative will have its bold goal, and we'll go over those a little bit later, as well as shared outcomes. So anybody that applies for funding will be measuring the same outcomes. So that's our first priority, is community impact. The second priority is ALICE. I think many of you have heard about ALICE. ALICE is Asset Limited, Income Constrained, and Employed. And so there's a segment in our population that is above the poverty level, but having a difficult time just meeting, basic needs, surviving within our economy. And so we're really focusing on the ALICE population and below. So community impact and ALICE. Now we've got service delivery. We are United Way of the Greater Chippewa Valley. We serve Eau Claire and Chippewa counties. And so we want to make sure that our investment in our community is going to cover both counties. Not only both counties, but the cities of Chippewa Falls and the city of Eau Claire. But not only the cities, we also want to make sure that we're covering the outlying areas as well. So the more rural areas. So we really want to attack those areas as much as we can. And then finally, collaboration. That's been a big thing with United Way forever, as long as I can remember, and it's no different. So we're looking for, when we talk about collaboration, we're not talking about just a referral. Agency B will make a referral to Agency A. That's important because if you don't have participants, you don't have a program, but we're really looking at taking it a little bit of a deeper dive. What does Agency B provide to Agency A to make your program better, or to increase the outcomes, improve the outcomes, and the indicators? So collaboration is going to be more than just that referral. So today, as we move through this, we're going to talk pretty high level. Detailed stuff is available in the application itself, as well as the RFP. So we certainly encourage you to, read those 2 documents that are available on the website. But as we move through today, keep these funding priorities in mind as we move forward. So Isabella?
All right, I am Isabella, as I mentioned. I will be discussing a bit about ALICE. So as Kelly mentioned, ALICE stands for Asset Limited, Income Constrained, and Employed. So what this means is ALICE is used to describe the households with an income above 100% the federal poverty line. So above 100% the federal poverty line, meaning that they make too much money to be able to qualify for any government support or benefits. So they don't really have any safety nets in case something major happens and they're unable to be able to pay for it or acquire the resources necessary. An example of a number of households that probably have fallen into it is kind of the households right now experiencing that in COVID as a result of COVID. So ALICE has become a constant resource in our community, and our RFP and applications are constantly referring to it. And then as you see in these lovely charts here, these show the minimum costs and minimum wages that are needed to live in both Eau Claire and Chippewa County. And the ALICE report is updated every 2 years. So this data says 2018. This data was released in 2020, and the next ALICE report is supposed to be released next year, I believe, with the 2020 data. So everything related to the ALICE report, including our application and ALICE report, is on our website. Next, we'll be walking you through the steps on how to get to the application. This is just kind of a screenshot of what it looks like on our website. So there'll be a programs tab here, and then under that, it will be funding information. And it'll take you to a page that looks like this. It might be a little bit hard to see, but as you can see, there's the RFPs, the application documents, action plans, and frequently asked questions. So after you click on the application documents, it'll take you to a page that looks like this. So you can either click on the little icon here or the blue bolded text here. Excuse me. And for depending on the initiative that you're applying to. And then if you click on one of the icons, it should take you to a page that looks similar to this. So right here, it'll have all the application, the attachment A, which is program budget, and the attachment H, which is the financial narrative questionnaire. So if you're a current program partner and this is the financial narrative that is the same as on the APRs, we're implementing this because to allow our finance committee to understand if there are any major, anomalies in the budget and other finances as well. Last, as part of the application documents, is the evaluation forms. So the evaluation forms are there to allow our applicants to understand how their applications will be reviewed. They'll be reviewed by our wonderful volunteer application review team, which will review the narrative, and then the finance committee will review the financial parts, and then also be reviewed by our advisor councils during the review panels. So this is to allow you just to better understand how you'll be evaluated when your application is submitted.
All right. So applying for United Way funding is as easy as 1, 2, 3. Okay, I can't even own this. So they did this one last time at the last grant cycle, and I'm like, let's keep it. It still works. So anyway, so the one is we're allocating, or we're investing $1 million into the community each year. So this grant cycle will be a $3 million grant cycle, $1 million per year, as I said. And we will divide that $1 million up into equal parts for each initiative. So each initiative will have $250,000 to invest in the community. Each initiative of financial stability, health, and education has 2 shared outcomes and indicators that are embedded within the application. So what that means is you don't have to think about the outcomes because they're already there. You don't have to think about the indicators because they're already there. So your program needs to be able to measure those outcomes and those indicators. Basic needs does not have outcomes. And the reason for that is it was felt at the last grant cycle that basic needs is really designed for immediate needs. We're not looking at trying to move the needle on anything when somebody's hungry, except for getting them food. So let's get them food, meet that immediate need. Whereas with education, health, and financial stability, we really are trying to move the needle within the community. We're trying to, achieve those bold goals, and we'll go over them. And as you'll see, those bold goals are kind of overarching goals. And so because of that, that's where those outcomes come from. 3, again, it's a 3-year funding cycle. That funding cycle will start July 1 of 2022 and run through June 30th of 2025. And 4, there's actually 4 applications. No, you don't have to do 4 applications for each one. You just have to do 1 application for each initiative. So each initiative has its own, most the applications look very similar, and there are some similar questions, but they are not all the same. And so each initiative has its own application. So please, please, please make sure that when you're writing the application that you've clicked on the right one and you've got the right one based on what you want, which initiative you want to apply for. Moving into the RFP. So the RFP was released back in, the request for proposal was released back in March. Please read this document. It's 8 pages long, I believe, but there's a lot of information in here, and it's good information, if I do say so myself. But it is good information. It will tell you a lot of things about the process. It will tell you a lot of what we're looking for. I think it will answer a lot of questions. We've tried to embed a lot of clarity in the application as well. So the questions may seem long in the application, but it really is to try to make it as clear as possible for you as the writer. So in the request for proposal, which is also, everything is available on the website. So when you look at the request for proposal, the very first thing you're gonna, see is talks about what we're doing and when we're doing it, talks about the process, how we're gonna get, from, applications, to the end of what we're trying to accomplish. Timeline is there. Embedded within the timeline is links to various meetings that we have scheduled. So this application is due July 30th, 2021 at noon. We are wanting not only a digital copy, so electronic version of everything, but we do want a hard copy as well. We will be, so you can mail that hard copy in, or we will be open to visitors and you certainly can drop that off. We want to see you, so feel free to stop by. We haven't seen people forever, so we're looking forward to having a little human contact. So I wouldn't mind if you dropped it off. But also, again, we have help sessions that are scheduled. Looks like we have 5 of them through Microsoft Teams. You don't have to attend them all. You can attend one. We'll go over the application in pretty good detail, but we'll also answer specific questions. So then you will see, again, when wait, did I say it was due June? It's due July 30th, 2021. Sorry if I said that wrong. At noon. Also, get into your calendars these grant review panels. What we do is, after they have been reviewed by the review teams that are community members, and we'll go into that a little more detail a little bit later, they finally get reviewed by review panels, which are made up of advisory council members. Get those dates into your calendar. We won't know what dates we're going to be using until we know how many applications we get. We try to work around schedules as much as possible, but it's very difficult to change the dates. We might be able to change times, but changing dates is really difficult. You can imagine how many people we have to coordinate. So we want you to get those dates into your calendars as quickly as possible. And then finally, your application goes through more processes here, and we'll go through that in a little more detail. Finally, December 27th, we will make announcements, and that's a hard deadline for us. We will have it on that date. We will be sending out award letters on that date for sure. And then the grant funding does begin July 1st, 2022. Next slide. All right. So some general information, eligibility requirements. So who can apply, things like that. Just because an organization has applied in the past and has been funded does not mean it's going to get funded again. I think that's really important. Everybody starts off at the same level playing field. You know, you may have been funded from United Way for 20 years, and you know, that doesn't mean that you're going to be funded again. Again, everybody starts off same spot. You know, having been a program partner and collected outcomes, you might have data that maybe a new program doesn't have. That's the only benefit that you really get. So keep that in mind. Funding priorities, we've already talked about a little bit. Just a little bit more detail on those, you know, in the RFP there. I don't need to talk about that any further unless anyone has any questions later on. Next slide. All right, so each initiative has its bold goal, has a target population, and has outcomes. So I'll go through those today for all 4 initiatives. The health application, its bold goal is mental health of the Chippewa Valley residents will improve by utilizing prevention and intervention programs. The target population is individuals and families with an emphasis on households at or below ALICE. And then the outcome is, and you only have to, in this case, you only have to select one outcome to measure. The first one is a prevention outcome, and that is individuals and or families will increase protective factors and or decrease risk factors to support mental health. The second outcome is intervention, and that is individuals and or families will demonstrate the ability to effectively manage life mental health challenges. Those outcomes have not changed from the last time. What did change is that you only have to do one. You don't have to do 2, and they actually don't want you to do 2. What we found is that oftentimes a program that tried to measure both prevention and intervention, the outcomes got a little bit muddied. And so it's probably going to be easier to keep that straight by just measuring one. And if you have a program that will measure, if you have one program that will measure prevention and another one that will measure intervention, then you would probably want to apply complete 2 applications as 2 separate projects. And then there's just some additional information there about potential strategies and methodologies and some definitions. Next slide. There you go. So the education initiative, the bold goal in the education initiative is children in the Chippewa Valley will enter school ready to succeed. Target population is children ages 0 to 5 in households at or below the ALICE threshold. This one here, the outcomes are the same again, but what is different is last time, if you applied for funding, you had to measure both. This time you can measure outcome 1, outcome 2, or both. That is your choice. And the outcome 1 is children in the target population will demonstrate optimum development in the following areas: health and physical well-being, social and emotional development, language development, and general knowledge. And outcome number 2 is parent, guardians, caregivers will provide supportive environments for children in the target population. So this is one I think is a really good example of how to explain what we're, specifically looking for. If you have a program that serves 10 to 15-year-olds, but it has to do with education, this grant is not for that population. It doesn't meet the bold goal of children in the Chippewa Valley will enter school ready to succeed, because a 10 to 15-year-old is already in school. And the target population that we're looking for is 0 to 5, and your program is serving children between the ages of 10 and 15. So we're really looking to target that bold goal and that target population. Next slide. Financial Stability Initiative. This one looks a little bit different, but the format is there. So the bold goal, the Chippewa Valley residents will achieve self-sufficiency through employment and training and personal money management skills. The target population is Chippewa Valley residents from middle school through approximately age 55. Some of the target population, we've talked about, and I just stated, we're looking at middle and high school students and students age up to 21 with an IEP. Those are typically still students that the school district is working with. Or unemployed adults, or those in low-paying jobs who need help to advance. Next slide. So their shared outcomes, they have 2, and within the first one, there's actually 2 within that one. So outcome number 1 is individuals who face financial challenges will have a steady source of income that allows them to meet basic needs and increase disposable income. And then the outcomes within the outcome is individuals who face financial challenges will have the general education and soft skills needed to obtain gainful employment. And then you have the indicators, and then contributing outcome B is individuals who face financial challenges will have the job skills needed to further their careers. And again, the indicators. And then outcome number 2 is individuals will have effective personal money management skills. And then the indicators that we're looking for. So with those 3 initiatives, again, the outcomes are defined, the indicators are defined. You must measure what is required out of each initiative in terms of outcomes and indicators. If you want to give us more data than that and show us other things that you're measuring, that's great. But you can't measure your own stuff and not measure this. And the reason for that is we're really looking to aggregate the data when it's done, at the end of each year, and start showing what we're doing as a whole. So we're investing $250,000 per initiative, and now we're going to be able to measure what that $250,000 does, because we have the same outcomes and the same indicators that each program is using. So we're hoping that will give us better data overall. Measure what we ask you to measure. If you want to give us other data, you certainly can do that as well. Next slide. And then basic needs is a little bit different. So in basic needs, there are no outcomes. And the reason for that is we're not looking to move the needle. We're not looking to make an impact necessarily on the community in terms of, a long-term effect. What we're looking to is take care of basic needs that are happening. So the bold goal is Chippewa Valley residents will have access to food, shelter, and medical services in their time of need. The target population is households living at or below the ALICE threshold. So pretty basic, definite pun intended there. Things that we're looking for is programs that will provide food, shelter, and housing, medical care, or any programs that enhance access to those services. So just really want, if somebody's hungry, let's make sure they've got food for the night. It's not about making sure they have food next month. It's making sure they have food for the night. Most of the programs that provide those types of services are looking at those longer term solutions. But in this case, really what we're looking for is let's make sure we've got the basic needs taken care of. Next slide.
I am going to talk about some other things, such as the policy and procedures. So as part of our application, there will be a text at the end, I believe, that says that you have read the policies and procedures on our website. So on our website, it's still under the Program Partners tab, but we'll say policy and procedures. I think you'll have to check or sign off that you've read the policy and procedures and that all of the documents are right here on our website. Next, as mentioned before, we have an FAQ on our application page. This is kind of what it looks like. The frequently asked questions. It's a tab that is right here at the bottom, circled it in red. And this is kind of the first page of what it will look like. So the FAQ kind of reflects questions that that United Way has been asked regarding the grant application in the past. And if there are new questions, they'll be updated on Monday. But please go through these if you have any questions. We highly recommend it just to answer your questions as well.
All right. So the grant timeline. Now we've kind of talked about that a little bit in general terms. So we'll go a little more specifically now. So the application was released in March, or the RFP was released in March. Application was released May 3rd. We have the grant meeting today. So we can check three things off already. The grant help sessions, again, will be starting in a few weeks in June. And so you can see that we have those already scheduled. Again, feel free to attend. If you've never written one of these grants, please attend. Even if you have, please attend. We may be able to answer some questions that, might make the process a little bit easier for you. Like I said, you only need to attend one. But if you have questions, feel free to ask. The application deadline, again, is Friday, July 30th, 2021 at noon. Our offices, we are in summer hours at that time. So our offices will be closed at noon. So if you show up at noon 05, the parking lot might be empty. Okay, so make sure that you are here sooner than that. Then the grant review panels, again, we talked about those dates. Please make sure you have those in your calendar. If you are not able to be there because you have the vacation of a lifetime scheduled and it's been scheduled for 3 years, and yep, I don't want you to miss that. But please make sure you have somebody that will be able to come and talk about your program, whether that's another staff person, board member. They'll be able to talk about your application, talk about your program, and answer any questions that the advisory panel may have. Again, December 27th, we will release funding decisions. And again, the funding will start July 1 of 2022. Next slide. All right, so oftentimes people ask, why does it take so long? We apply for funding in, you get our application in, the end of July, and we don't find out until the end of December. Well, one of the things about United Way is that, we have a lot of donors that we are accountable to. And it's important to us that we tell them and show them that we have integrity in our processes. And therefore, that takes time. So what happens to your application once we get it here at United Way is it keeps moving. It's not like it sits on somebody's desk for a long period of time. So the application comes in the end of July. A couple things happen in August. In August, there'll be a screening process with the United Way staff. We just check off, make sure that it got turned in on time, that signatures are there. Then it will go to our application review team and our finance committees. That's two different folks or two different groups of people. We have about 50 community members that we have recruited that will be reviewing all of your applications. Those community members will be trained. Each community member, they'll be placed on teams. We don't know how big the teams will be yet. It all depends upon how many applications we get. And we're hoping that they only have to review somewhere between 3 and 5 applications as a total, each person. So they will have about a month to get those done. And then the finance committee is about 10 people, and they will be reviewing, maybe a little more, they will be reviewing every application that comes in, the financial aspects of it. Based on that, each application will then get a score. When that score needs to meet a certain threshold to move on to the grant review panel. As you can see, those grant review panels are in September. I think there's one that might bleed into October. Once that happens, then each advisory council, there's an advisory council for each initiative, so there's 4. Their October meeting will be making funding recommendations. So that happens in October. And then in November, we have a community impact committee that those recommendations will go to the community impact committee. That committee will then make a recommendation that will go to the executive committee of our United Way board in November. And then finally, it will go to the full board for final approval of the board of directors in December, which is why you will get an award letter one way or the other on December 27th. So with that, next slide. So what we have here is just, I was going to say, wow, that was kind of weird. What we have here is just the links to various things that we've talked about today, various documents. And again, this will be available on our website. So the slideshow will be available on our website, as well as this recorded informational meeting. So if you want to go back and listen, you certainly can do that. So that is there. And with that, I believe, any questions? So now's your time to unmute yourself if you want, ask questions, or ask questions in the chat box. Leave if you want. Stick around and talk to us. You know, you can do that too. Shift you over here.
Kelly, I have a question. Sorry. What is the grant and review panel?
So the grant review panel is made up of members of our advisory council. And so it's a smaller group. It's not the entire group. We do look at conflicts of interest. So we try to eliminate those. And not try, we will eliminate those. And so if somebody applied for funding that might be on the advisory council, they won't be able to be in the room when we do that. And in fact, we try really hard not to have them on the grant review panel, if at all possible. We do have processes in place, though, that if a organization applies for funding and a representative is on the grant review panel, they will step out and not be part of that process.
And organizations will have 5, and agencies will have 5 minutes to present their program, correct?
I think it's the whole thing is 30 minutes long.
Oh, okay. So there's a 30-minute presentation.
Yes,
That's
I think.
Yes. From Dawn, hand raised.
which I had my hand raised. Is that, I'm not sure you're referring to me.
Yes, I was referring to you. Sorry.
Oh, sorry, Don.
Okay. Yeah, I'm Don Mowry, and I'm working with I would call it an emerging nonprofit. And I was just wondering, we are hoping to begin to offer programs for people who are getting out of jail and prison to support them in their reentry process. But is it possible to request a budget that is different from year to year? Because we were thinking of offering a program for women the first year and then men the second year, and add to it basically to expand slowly and not necessarily start in both counties with full programs right away.
Yes, I want to answer that question, please. Yes, so our grant is unique in the sense that we allow programs to fill out if their budget changes from year to year. Whereas, and I know that some grants are like, you need to set one budget and it's going to be that same one for every single year, but you can change that.
And if we have questions about whether our programs fit or which initiative, who can we consult with?
Any of us, either one of us.
Any of us. I can put our Kelly and I's email address inside the chat.
That'd be great. Thank you.
Yeah, the main thing to remember, Don, is that, as you are, looking at the request for proposal, if you can measure, you have to be able to measure those outcomes.
Mm-hmm.
So if you can measure those outcomes somehow within your program, then you should be, measure the outcomes and they hit the target population. You should be good to go. But yeah, you certainly can give either one of us a call or email us or whatever. We'll be happy to answer.
Thank you.
So I'm reading for the Financial Stability Initiative, are we accountable to one of the outcomes, or can we serve both groups, middle school and high school, as well as unemployed adults? You can do as much as you want. So if you have programs that will serve all of them, you certainly can do that. But you don't have to do them all. Don't try to be an overachiever. Make sure what you're doing well. So, but if you serve all of that entire population, absolutely. Other questions?
Yeah, I just want to make sure I have this down correctly. So with the outcomes, you only want us to either look at prevention or intervention. You don't want us to look at both? Is that correct?
Yes. Unless you can really distinctly show that difference, you only have to do one or the other. What we were finding was that many programs were saying their program A was an intervention program as well as a prevention program, and their outcome numbers were exactly the same.
Okay, so how would you suggest deciding if it's intervention or prevention? Because I think that we applied with both, and that's what we were anticipating doing this next grant cycle. So how would we decide which one? Or I mean, is it possible that we would still do intervention and prevention because we're working with adults and kids?
Under the mental health program?
Health. Yep.
Or health. So I think if your numbers were going to be different, I think what we were trying to get away from is, the programs that were serving 100 people and under intervention, and then they were calling the same 100 people the prevention folks, and they were doing the same thing. So I think if you have different numbers of people, like it's like what you're doing with the kids is intervention, but what you're doing with the parents is prevention. Is that what you're
I mean,
getting?
no, I mean, it could be, I guess, but I mean, really, the kids that we're working with are still experiencing violence, right?
Mhm.
So it's probably, I mean, maybe both populations are still, we're still looking at intervention more so than prevention.
Yeah, I think for you, I think you probably just pick one and stand on it. You know,
Okay.
whatever you think is best.
Okay.
Yeah,
Okay. Great.
yeah, I think you'll be fine.
Okay.
I don't think
Thank
there's
you.
a right or wrong answer.
Okay. Okay. That's just different than what we had done and what we were planning on. So I just wanted to make sure I
Yep.
had that correct. Okay. Great. Thank you.
Yep.
Hi, this is Kim Gillette. I don't know if I can hop in. I just have a question on collaborative partnerships, and you recommend a MOA for partnerships. I'm just curious if that would be recommended for all the partnerships or just the specific ones that tie more, obviously that tie more directly in here, I'm assuming, but is it really strongly recommended unless they're fiscal? Could you talk a little bit about that?
So for the fiscal, you know, when there's that fiscal relationship,
Mhm.
definitely,
Yeah.
Definitely want the MOA. And the reason for that is, you know, rules come out of, you know, issues more often than not. And so there was a time when we had two program partners that were in a grant together and they had not sorted out their fiscal relationship and it became an issue. So we want you to sort that out ahead of time. So when there's that financial relationship, definitely have the MOA. When it's not that financial relationship, but just your program kind of collaboration, I don't believe the MOA is required, but obviously it will certainly help you guide your, you know, guide what you're doing and how you write your grant. Part of the reason why we give you so much time, you've got about 3 months to write this grant. Part of the reason is we want you to talk it through and think it through. This is not a grant that you know, it's due Friday at noon. Don't start it Wednesday at noon. You won't get it done. You know, so don't do that. Because you do need to have, you know, you do need to have conversations with people that are going to be your collaborative partners. We want you to think about, you know, your outcomes and how you're going to measure them. So we want to give you the time that you need to, you know, to develop that. There's a question, financial stability has two bold goals, but they are very different. How can we apply for the initiative if one goal is not in our wheelhouse? So there's one bold goal that kind of encompasses both two different things. But you only have to apply for one of the outcomes. So I think the outcomes should divide that up. And if that doesn't make sense, you can give me a call or text me or email me and we'll figure that out. Just to also let you know, Isabella and I have represent different initiatives. So I represent the basic needs and financial stability. Isabella does health and education. We failed to mention that when we did our introductions today. So twice we failed to mention that.
I will put that in the chat with an updated one with our contact information to show which initiatives that we lead.
Kelly?
Yes.
You want to go over with everybody again about the true meaning of a collaboration and not a referral with other agencies?
Yep. Yeah, to make it as simple as possible, you know, we're looking for more than just agency A is going to refer to agency B. Yes, it's important that you have participants, because if you don't have participants, you don't have a program. But really, you know, the best way that it was and simplest way that it was, put to me was, what does agency A bring to agency B's program that makes agencies B's program better? Okay, so whatever that may be, whether that's money, whether that's a human, whether that's, an in-kind service, whatever that may be. Does that make sense? That answer it, Kim?
Yeah, because I've often been in situations where I've heard agencies think they have a collaborative partnership, but all they're really doing is referring their people over to another agency, which is
Mhm.
not really a collaboration.
Right. Mm-hmm.
Any other questions, concerns? The the grant information presentation will be available on our website. That will also have our help sessions on it. So if you have a question, or didn't have time to ask the question, or we'll think of another one later, you can either email us or attend one of those grant help sessions, and we can definitely answer it or try our best.
So the take-home message from today is read the RFP. As you're writing the grant, read every word that's on it. Don't skim it. There's instructions to try to make it easier and clearer for you. So those two documents are pretty important. The Alice report, that's just good information, and that report you can use for other grants too. So just be aware of that it's available on our website, and know who we're talking about. And then action plans. Each initiative, with the exception of basic needs, has an action plan that was done several years ago, but we've updated some information in it. That kind of gives you an overview of why we're doing some of the things that we're doing. Gets into a little bit deeper dive of that. So there's lots of, and also check out the evaluation tools that we're using. We want you to know how your application is being reviewed. It's all there. I don't know. I don't know what else we can give you to show you and to be as transparent as we can be about this entire process. What I think is really important for you to know also is Isabella, myself, Andy, we don't decide anything. This is all done by the volunteers that we have and have put in place. They make the decisions. So we're just here facilitating processes, making sure all of the information is available not only to you, but to them, so that they can make the best decisions that they can make as well. So I'm not saying you shouldn't have any questions, because obviously if you do, we want to be available to answer them, but there's a lot of information out there. Please use it. And I think it will make your process hopefully a whole lot easier. Any other questions? All right. Well, everybody's free to go. If anybody wants to stay on and talk about the Packers, or needs a Nelson update, or learn about Texas, talk about the Express, we'll be willing to do that. But if you want to go, thanks for attending today. We certainly appreciate it. Have a good rest of the day. Happy, or not happy, but have a good Memorial Day weekend.
Thanks, everyone.